We had a work session, had good discussion from all council members, and now I'll open the floor up for this particular item of new business.
I have a question.
Ms. Lockridge?
David, if we were to pass the ordinance, what would be the leeway into the ordinance? How
Yes.
much period of time would it be before we actually started it? Well, I shouldn't say that. We do a period of time when we educate folks about it, and then how long do we do that before we go into the ordinance?
Yes, sir. The ordinance as written, says it'll take effect June, July the 3rd, 2020, and this is an emergency ordinance, prior to one reading, so it lasts for 60 days. And so, July 3rd is Friday. However, if you wanted to amend that, you certainly could.
Good question. Ms. Stewart?
Well, the way I understood your question, Councilman Lockridge, is like, if we pass this ordinance that goes into effect on July the 3rd, and correct me if I'm wrong, say July the 3rd comes and somebody doesn't wear a mask, I think he was asking, how long do we educate them before we issue the fine?
Okay, yeah, to answer that question, just like any other recent ordinance that we would pass, that'd be a normal course of business that, there would be the officers would first take the approach of educating.
Exactly.
And then, it depends on the reaction of the individual, go to what's necessary. And maybe they just say, hey, I'm gonna wear the mask, or, some other response, but, we do that as a normal course of business on any new ordinance that we pass.
Thanks for clarifying. Anything else?
Can I make a motion?
Yes.
Sorry, go ahead.
No?
That's about the ordinance, right?
Yes, go ahead if you want.
That's not the resolution.
That was the ordinance, yes, ma'am.
That was the ordinance.
Hold on, before we go in discussion.
Okay.
We have a motion on the floor.
I make the motion that we accept the emergency ordinance for face masks in these public places that we mentioned.
We have a first by Mr. Lockridge. Do I have a second?
Can I amend the motion?
And just to clarify, face coverings?
I mean.
Face coverings, I should say.
Okay.
I'll make a second, but then I would like to amend the motion.
We have a second by Mr. Stewart. Your amendment?
Well, if it pleases you, Councilman Lockridge, I'd like to amend the ordinance to kind of mirror what Councilman Chapman said. I would be in favor of passing this ordinance, as it relates to, any establishment that, I guess, that's kind of what the city manager said, that sells, food items, well, not food items, grocery stores or pharmacies, that deal strictly with grocery stores and pharmacies and wouldn't entail, the other areas. I think the restaurants, the bars, and other establishments, I think that the way it is now, they can make their own laws, to require their patrons to wear a mask to come in if they choose to do so. But again, I think that, not to rehash it, but, for the people, the caregivers, great caregivers like yourself, that doesn't have a choice, and you have to go to these places, we got to makes you feel a lot safer. So I'll see if you would consider amending that change.
So I think probably more specifically, we're talking about section 1 in the ordinance. Can everybody turn to that? And Dr. Thompson, I'll get to you and Mr. Chapman. So in the second sentence, it says, for purpose of this ordinance, the term grocery store shall mean a retail establishment that primarily sells food, but may also sell other convenience and household goods. I would assume that's the
Yes.
sentence that you're talking about. Now, be clear in how you want to amend it.
Can I add
Wait a second. Tony, do you want to?
That sort of concludes that, doesn't it?
Well, I think, I was reading it included all these establishments, but, if it's only related to grocery store and pharmacies, then I'm, if that's what.
You're okay with that, the way
Okay,
it is?
yeah, but
We had Dr. Thompson and Mr. Chapman.
Because I think we're kind of doing that now, grocery stores and pharmacies.
Let's get, city attorney, let's walk through. Go ahead.
I just wanted to make you aware on the emergency ordinance that's required 2/3. But that would be at least six of you have to vote in favor of the ordinance for the tax.
Okay, thanks.
Questions? It says 60 days. That's too much.
Yeah, man, so, emergency ordinance is for 60 days, and that's just what the state statute allows us to do for emergency ordinance, one reading. It lapses after 60 days. Doesn't mean you can't redo it. Doesn't mean that we can't do two readings of another ordinance that extends it for another period of time, so.
I just think, you know, we're going into the summer now. Lots of things going on. And if we can only talk about grocery stores and pharmacies, basically. 60 days of this. Unless we got the, option of coming back to council
Oh,
and
yeah.
looking at what is not happening.
You always have that option, so this is allowing it to put in place immediately, that's what emergency ordinance does, but it only allows you to do it for 60 days, but since we have regular council meetings at any other time, you could adopt, another emergency ordinance that extends the time frame, so.
I'll let that clear that way, sir. Did that clear that up, Dr. Thompson?
Kind of.
Good. Mr. Chapman, then
Two.
Mr. Stewart.
Two things, one to add with what Dr. Thompson said. Likewise, we can extend it or we can terminate it, correct?
Yes, sir.
Okay, so the other thing that I'd get back to, because I appreciate Councilman Stewart's amendment, but at the same time, I think if we're gonna require grocery stores and business or pharmacies to do this, I think we need to take the leadership role that just like with somebody paying their water bill, they have no other option if they don't have they have to come in and pay a water bill or they have to receive a permit. So I think if we need to take the leadership role on that we're requiring patrons that or citizens coming into the city buildings or employees that are in direct contact that cannot social distance, they should also be required because we would take the leadership role.
Right, in many cases, in almost all cases in a municipal business center, there is a glass partition that separates their interaction. But the language I've seen that you referred to can say, patrons visiting a city building or municipal facility, wear a mask, and then when it's not, when there's not social distancing available or either through a partition, that the employees wear one as well. So, for example, if there wasn't a complete glass section there and you were counter to counter, then employees would wear a mask, the patient would be expected to wear a mask.
Okay, perfect.
Right.
Thank you.
So as it stands, the way I understand, we have a first, we have a second, we're still in discussion.
Second.
No, we already have a
Okay,
second.
you're.
Before we vote, the emergency ordinance, the 2/3 vote, is that correct?
Yes, sir.
Can you explain to not only us, but also the people in the audience and the media and everybody else, what classifies an emergency ordinance versus what we normally do?
Yeah, emergency ordinance arises when there's something, as the name is, that it's something in front of you. And that's what you've seen all the cities do across the state, that's taking some type of action. And we need to have a special call meeting, and you want something to go into effect immediately, that is law. And that's what emergency ordinance allows you to do, so that way it's quick. Otherwise, if you didn't do emergency ordinance, we would be doing first reading, typically during a regular meeting, could be a special call meeting, and then you would have to wait another 7 days to have another special call meeting or your regular meeting to do a second reading to put the ordinance in effect. So the only way, so they allow this provision of doing an emergency ordinance so that when things like this arise or you had a natural disaster or so forth, in this case, the pandemic is essentially a natural disaster, you could put something in place immediately that is law and carries the weight of that. And that's what this allows you to do without doing two readings.
Thank you.
Ms. Stewart?
I'd just like, to add that, I just think it's very important that, we pass this ordinance because it lets us be proactive instead of reactive. I know that, we can change this at any time, we can come back in 2 weeks and change it, but, because it allows us the ability to do that, but I would, it's before us now, and I think that, it can pay big dividends, for us, and, again, I just think that, we've been doing and if you haven't seen, the cautions, if you watch TV, commercials talks about social distancing, talk about wearing masks, and if you don't know that people are being educated for the last 4 months, I know that's an important piece, but it just hasn't got us to where we need to be, so with that being said, I'd just like to see that our city, just be proactive on this matter, and again, it really helps those people, like Councilman Lockridge, who is a caregiver, to kind of protect his family and their families when they go back home.
Thank you.
And not just my family, it's all folks that go out to have to go into these places
I agree.
on a regular basis, and that's why we need the ordinance.
Thank you. I'll call the question, and we have a hand vote. And so we have a first and we have a second. All those in favor of the ordinance, please raise your right hand. Mr. Chapman, Dr. Thompson, Mr. Lockridge, and Mayor Pro Tem Mr. Stewart. All those opposed, like sign.
So it fails, because it needs 2/3.
Yep.
Right.
And Councilman Harden's on the line. Well, he's not gonna count anyway, he's not here.
Has to be 2/3, right?
Ma'am?
I just don't think a resolution is gonna make any difference.
We'll go directly to the next item, the second new business is request consideration of emergency resolution requiring individual to wear face covering in certain circumstances and matter related thereto. We're still in discussion. I didn't mean to cut.
So this resolution,
This is the resolution, item number 2.
did I ask a question?
Yes, ma'am.
Resolution covers the same thing that we just talked about.
Yes, ma'am, so it doesn't put it into a law, it makes it the public posture of the city, that, the recommendation is to wear, as city officials and, city staff, to wear, face coverings in certain situations to include grocery stores and pharmacies, all employees of restaurants, bars, retail establishments, and so forth, in section B of it, and the city development program to educate the public.
How long is this resolution? Is there a limit to that?
There's not a limit, because there's no law, so.
But if you think about it, if this did not work, say within 2 weeks or whatever,
Well,
come back, then
Count.
that resolution makes a difference.
Oh, yes, ma'am. Council can also always take additional action.
It would have to be unanimous for everybody for the resolution to
No.
Six.
2/3.
No, not 2/3, just
Two-thirds.
just a majority vote. It's not an emergency ordinance.
Okay.
Mr. Mayor.
yes, Mr. Chapman.
Just out of curiosity, Mr. City Manager, I noticed that the ordinance had retail establishments, and we struck that part of it along with barbershops. Of course, that's part of the governor's thing, but the retail stores was in the ordinance, and we struck that, but it's not in the resolution. Is there a reason for that?
It has retail establishments in section B for the employees, but as far as no, the language just didn't get carried over on the document, so I mean, that certainly could be added.
Okay.
Or anything else that you see that's fitting, which could be municipal buildings or, public transportation. So.
Mayor, correct me if I'm wrong. So under new business, in what you read, request consideration of emergency resolution, but this is not an emergency resolution, this is just a resolution.
This is just a resolution.
Right, when it's a resolution, it doesn't require a supermajority, so.
Can I ask a question?
Yes, sir.
Okay, it says a resolution requiring. The word require means that they have to.
So it starts off in the title, let's just say, so it's a resolution, so calling recommending that individuals work covered in
And we
certain
need to change
circumstances.
the wording to recommend.
So where are you seeing
On
required?
the agenda item?
On the agenda item.
Oh, okay. Well, it won't, if you vote on this, the agenda item essentially has, the wording and the typo on the agenda item does not conflict with the actual resolution, if the resolution succeeds that.
Can I ask
Yes, sir.
What would be the test for coming back and saying after the resolution, if the resolution is voted on? What would be the test to come back and say, this is not working, we're gonna have to go with this?
Well,
I mean,
Yeah.
I'll answer. I think it's the numbers. The numbers,
Growing?
the numbers, the hospital inpatient numbers,
Gonna be
again.
people put in the hospital because
I
of that.
mean, as you mentioned before, they have increased. And the hospital system is ready for a possible surge. And, again, that's why I feel somewhat comfortable that we will be here in 2 weeks on this same, if we have to, or another call. Ms. Stewart?
No, Councilman.
I'm sorry. Jeff?
We seem to be repeating ourselves, but I'm all in favor of this public awareness, public education approach. And to my council member, fellow council members who voted against or voted for the ordinance, I voted against it. I encourage you to vote for this resolution. Let's get something started. Let's begin the process. We can always revisit the ordinance. So with that, I recommend that I move that we adopt this emergency resolution.
Not an emergency, just a resolution.
Resolution, excuse me.
We have a first.
Resolution.
On the agenda item, we have a first by Mr. Jeff Roberts, second by Mr. John Roberts. Discussion. Dr. Thompson, yes, ma'am, we're in discussion.
Just want to make sure that the last part of the resolutions, the patrons, grocery stores, employees, and all, has that been taken away from the resolution?
It's in section A of the resolution on page 2.
On page 2, said that. What
Grocery
about-
stores and pharmacies.
Yeah, is that part of this resolution?
It is for the resolution.
So if we vote for this, then we're talking about grocery stores, pharmacies, all those things are included in the resolution.
Yes, ma'am. Grocery stores and pharmacies in the city wear face coverings while inside the store, and also
Restaurants, bars, and saloons, grocery stores, and all of that.
what it says in section B, all employees of restaurants, bars, retail establishments, saloons, salons, etc., where the employees wear face coverings.
Okay, so it means that, these places can still be open, with that down.
Oh, yeah, absolutely. So what it does is the resolution allows us to boost our campaign by saying there's official posture of the city officials to promote this and have partners from those businesses to make sure that their employees are wearing face coverings, and then also patrons of grocery stores and pharmacies wear face coverings. And so that boosts our posture as far as the outcome of the public awareness campaign.
And there will be a time limit for this,
No, ma'am,
that we need to come back.
unless there's additional action by council.
Any other questions?
The additional
Act.
will be brought up by council versus being brought up by the administration.
I'm following 3 metrics, as far as numbers, the hospital numbers, the report of positive to total tests, not for the state, for Anderson County, and then the cumulative number, and a cumulative number particularly not over the entire course of the state, but within a 14-day period. So those are the metrics that we're tracking. And so, and we'll continue to report those to you. We'll continue to send those to you, and we will look those 3 metrics. And then, I think your other question was, I might have missed the second part of that. Did you have a second part?
No, I didn't have that.
Okay.
Mayor Pro Tem,
Just, and I know we need to do something for our citizens, but, again, this resolution is what we've been doing for 4 months. We've been encouraging people, and this is all this resolution does, is encourage you to wear a mask, encourage you to have social distancing. Well, that's what we've been doing for 4 months, and it hasn't worked, to the degree that it needed to work, for whatever reason. And, why wait for 2 more weeks for, my mom your family members or any of our audience family members to get COVID where it could be prevented or have a better chance to be prevented by wearing a face mask. You know, why wait for 2 weeks to come back and say that it's not gonna work? We can change that today.
And
We
it's
can
not a
make it.
big deal to wear a face mask.
We can change that today to make it happen, and instead of waiting for 2 weeks. Again, let's be on the cutting edge, let's be proactive instead of reactive. Don't be reactive and come back 2 weeks from now when the hospital beds are at 35 before they're at 20. Let's come back in 2 weeks and say, it's great, they're down to 9 now, or what we're doing. That's all I'm saying.
Thank you.
Mr. Mayor.
Ms. Chapman?
I agree with, you know, again, I go back to err on the side of caution. Unfortunately, the ordinance has failed. You know, I will support the resolution because a resolution is better, is better than nothing, I believe. At least it continues to reinforce our message. My one thing that I wanted to elaborate with, what Councilman Lockridge said is that, you know, what is the measure? So if we're not at the peak yet, or we're at the base where it's gonna increase, and it says that it takes 2 weeks before somebody can have it and carry it for 2 weeks before they actually show symptoms or be asymptomatic, we may not even meet at that. So it might be a month before we've let it grow to that point. So that's, but unfortunately, the ordinance has failed. I'm gonna support the resolution, because it's better than nothing at all.
Ms. Newton?
Mr. Mayor, not to keep throwing curveballs at you, but I'm curious if Mr. Jeff Roberts would be open to, in addition to his motion, where it would read, to approve a resolution recommending individuals to wear face coverings in certain circumstances, and to instruct staff to provide empirical data regarding their public information campaign at our next scheduled meeting. Because I would like to see more information. Yes, ma'am, it would read, if Mr. Roberts is open, essentially start the same way, to request consideration to approve a resolution recommending individuals to wear face coverings in certain circumstances. But it would also instruct staff to provide empirical data regarding their public information campaign, which are starting tomorrow. Because I would like to see additional information at the July 13th meeting.
Report this to the council.
Yes, ma'am, yeah, at our next meeting, because I would like to see more information.
So
If
So the
Mr. Roberts had his
amendment
own.
would be this amendment, the lead-in on the resolution part of it?
Yes, the resolution, all that stays the same, just instructing staff at our next meeting to provide that information to us.
And what you could do there is just under item C, where it's already instructs city staff to develop a program to educate the public. It includes data, providing data to the city council as well, based on the metrics I described, and also data as to the public information campaign.
You good with that?
Yes, sir.
Admitting the part C of this?
Yes, ma'am.
That'll be part of our public education process anyway, right? This data will be available to the public on our website, or?
Well, yeah, the data is always available to the public on the DHEC website, first of all.
Okay.
They're creating a dashboard.
But are we
for
gonna reinforce that data through our public education? Is that what Mr. Newton is requesting?
At our next meeting.
Well, also to the decision makers, to the city council.
Not only us, but also to the public.
Yeah, I think to the public's already written in there. I would just
Yeah.
like to see information at our next meeting regarding their campaign. Because I'd like to see, you know, if the city does distribute masks, if so, how many, which locations, things of that nature.
I'm open to that change, that's fine.
All right, thank you.
Okay. We have that, change that is first and second into that.
I'm still sitting there thinking about all of this, and this is really serious.
It is.
This is very serious. And thinking that the resolution to me, if it works, I probably would be willing to give it a chance for 2 weeks, just to see if it made a difference. And what I'm thinking about is an education for the public. Because a lot of people are not thinking about what we're talking about here. A lot of folk out there just say, I ain't gonna do this, I ain't gonna do that. But if it made a
there's a couple of things there, because, you know, we can certainly account for how many maps we distribute, how many, people we talk to, how many we reach through social media and so forth. But in 2 weeks, the public lab is again backed up. So what you're gonna see is that at Homeland Elementary, they just tested 1,000 people. Those tests have yet to come back. And then before that, there was 800 tested at the Civic Center, some 800 tested at the Civic Center. And you're just starting to get some of those numbers weeked in, but they're not all processed yet, because there's a lot of sampling, there's more testing going on in South Carolina than there ever has been. There needs to be a lot more testing to actually identify what's going on. But in 2 weeks, you're essentially getting things that happened, within that 2 weeks when we reported on things that happened 2 weeks ago. And so, because there's a lag right now, so I mean, to look at the data, y'all must have to look over the next 30 days, and I'm just caveat on that.
How many folk even know about it? We're gonna do this tomorrow, this campaign. How many folk know about it?
Well, it starts, I mean, it's been a full launch, and we're gonna be doing all kinds of things. Right, it's just, it'll be ongoing.
Like t-shirts and whatever else, only at Ren Park.
No. We're gonna be on Main Street, we're gonna be in neighborhoods, we're gonna be, apartment complexes, we're gonna be wherever. If somebody invites us to go, we'll go. But we're gonna be all over the city.
Ms. Roberts, Robertson, and Mickelson.
Yeah, so, with regard to the testing, I personally went last Friday, my office staff, family members, friends, et cetera. Most of us have all heard, actually by Saturday, the results, so.
There is
I know there's still backlog.
Yeah, it just became a lag.
Yeah,
The hospital
so I'm thankful for that. Hopefully some of that data is already included in those numbers, because that was almost 2,000 tests, right? Thursday and Friday, or Friday. So hopefully,
And that's what I was talking about a while ago, John. The fact that you have people walking around right now that have it, that have no idea they've got it. And they're spreading it to people that like myself, or like my wife, or like my sister, or like my, uncle. Why do they have to be put in jeopardy for 2 weeks? Because we have to see if this is gonna work. I think it's a waste of time.
I'd like to finish. I'd like to take this opportunity before we go any further, no matter what happens. We're taking it serious. This is a serious conversation. This is not a joke. It's not a play. We're not trying to keep up with any other community. We're trying to protect our community. And I would encourage our media. I would encourage the newspaper. I would encourage our businesses that link to our downtown websites, our social media, et cetera, to all spread the word and use this time now to help encourage everyone to take the right action so that we don't lose the precious lives that we're discussing today. My family, included, I have members of my family, my parents, et cetera, employees with parents that have underlying conditions. We're all taking this seriously, and I encourage everyone to put it out there and act appropriately. It's time to take responsibility.
I do want to add one thing, back to a comment that was kind of said earlier, that we're behind, or maybe behind on things. We were the first to before the governor's announcements, to actually start closing parks, require social distancing, limiting gatherings, and put a lot of restrictions in place before the governor ever spoke to that. And Anderson did that before the majority of the cities in the upstate, and really any city in South Carolina. We were on the front end of that. So from the initial response of it, when we identified that this was hitting Anderson.
Parks are open now, right?
No, ma'am. It's very limited. It's passive use. The basketball goals are not up. They're closed because they create a close gathering. The fields are restricted for just passive use, going out there and throwing a ball with your dad or something like that.
Things on the front page today, they said parks are open now.
We did open just the playground. The parks have restrictions on them, and so they're not just completely open for as normal like they were before COVID.
Go ahead.
I would just like, say that it looks like, this resolution is gonna pass, and, I'll just ask, I know we talked about the community partners that we're gonna partner with, you know, ANMED, School District 5, and getting the word out. I think the very important piece that we left out is making sure that we make contact with Mr. Jeff Trahan, the Director of the Anderson Housing Authority, because, riding by the Fortson Home, the Fairview Gardens, kids don't have anywhere to go to play in the park, so they're just gathered out there 25, 30 at a time, just playing, and I think that educational standpoint with working with the housing authorities, you know, in our public housing settings, you know, can go a long way, so I just ask that, you know, that y'all make contact with Mr. Jeff Trahan.
Thank you.
Certainly, thank you.
So all those in favor of considering the emergency resolution in regards to face coverings and certain circumstances and matters related, raise your right hand. Mr. Roberts, John Roberts, myself, Jeff Roberts, we have Don Chapman, Kyle Newton. Those opposed, and Dr. Thompson, I'm sorry. And those opposed, Mr. Lockridge and Mayor Pro Tem. So that passes on that vote. Having no other new business, I will entertain a motion to adjourn.
Everybody stay safe, and have a 4th of July.
Second. All those in favor say aye.
Aye.